Welcome, everyone, to the Singularity Lab, the show where we explore the intersection of society, culture, and human evolution through the latest advancements in science and technology. Thank you so much for joining us as we help you navigate the exciting and rapidly changing landscape of tech and its impact on society. I've got an amazing guest for you today. Joining me is Ryan Tanaka. He is the creator of the popular YouTube channel and podcast Neuropod. As an AI enthusiast and futurist, Ryan has dedicated himself to providing his audience with comprehensive and engaging content on the latest developments in brain-computer interface technology, artificial intelligence, machine learning, and related technologies. Ladies and gentlemen, without further ado, Ryan Tanaka. What's up, brother?
Hey, Mike.
It's good to see you, man.
Yeah, nice to see you too.
Fantastic. So I want to dive right in with you today. We've got a lot to cover. But first, I'd like to get a little feedback on kind of your inspiration. What drove you to launch Neuropod? It's been incredibly successful. You've really gotten the heartbeat on what's going on over at Neuralink, as well as what's going on with brain-computer interface technology in general, as well as AI. So if you could kind of give us an update on what inspired you to begin this journey.
Sure. It started primarily with Elon going on Joe Rogan's podcast the second time. He talked about how Neuralink would eventually help solve a lot of neurological problems. He talked about like helping with blindness, hearing loss, eventually helping paralyzed people regain their ability to move their limbs. And after I heard that, I was very inspired by the mission of Neuralink. Prior to that, I had heard of him talk about it on Joe Rogan's podcast before. I've heard him briefly mention it on like a TED conference or a Recode conference. And I wasn't super motivated to start the podcast because of all of the AI related things and the sci-fi futuristic things. It was more like the medical applications are so fantastic. I'm going to learn more about what they're doing and how they're going to do it. And then over time, I started realizing like, wow, there's plenty of crazy things that they'll enable if they have an advanced Neuralink, or if they develop an advanced Neuralink. And so, yeah, now I've started to learn more about how this is all going to shape up and what the applications are going to be and what types of medical applications there are and how they're going to do it and all that.
So for you, this was more about what are the medical applications as opposed to this sort of sci-fi future that it seems like we're all headed towards. In your opinion, what are the, obviously you do a monthly update on Neuralink on your show. What have you seen over the past couple of years since you began? Like, what's the biggest surprise between when you began tracking this and where you see Neuralink heading now?
That's a good question. Well, I guess I knew that the progress was going to be slower than many people would want. And I guess it's even slower than I initially anticipated. And I think it's largely due to me not appreciating the complexity of what they're working on. Like
Right.
Literally just having less of an understanding of how the brain works and what technologies are going to be required to be developed in order to enable them to do what they're wanting to do. They're also working on a device and other supplementary devices and processes that like the rest of the industry hasn't even tried to do before. So I think like because of all those things, like, and also at this moment, the regulatory process, things will develop quite slowly, no matter how amazing the team is. And I think that's also underappreciated. Like their team is fantastic and they're making progress. It's like they're simultaneously making progress very quickly and also much slower than people are wanting.
Now, is the slowness due to the FDA? I mean, I've been reading a lot of news articles lately about Neuralink and how challenging it's been to get FDA approval to begin studying these sorts of things on human test subjects. And I'm just curious, like, maybe we could back up for just a second and really talk about what a brain-computer interface is. Can you kind of define that for us from, from both a Neuralink perspective as well as a broader industry perspective?
Sure. So basically, like, interface is like a connection between the two. So I guess the tangible way to think about it is that right now, like, our brain interfaces with our mobile phones or our computers with our fingers. When we're providing input to our laptops or our phones, like, we're typing with our thumbs or our fingers, and then we're also giving some input with our mouse. And that input is pretty slow. It's very slow, actually. And then when we're receiving information from the computer or from our phones, we're receiving it in the form of audio and visual information. And that's much faster than the input is, but it's still not as fast as it could be with an advanced Neuralink.
Right.
So really what Neuralink is trying to do is make sure that that interface or bandwidth, the like transfer speed and amount of information between the brain and the computer becomes orders of magnitude faster and more than it currently is. I think other brain-computer interfaces or brain interface companies, they're often working on devices that have lower bandwidth, but more short-term practical use. And so, like, Neuralinks is an invasive surgery that would eventually enable a very high amount of information or high bandwidth interface. Whereas some of these other companies, it's just a device that you put on your head and you can get some amount of data. It's lower bandwidth, but it's more immediately useful.
Right. I think one of the biggest challenges people have when thinking about this sort of technology, well, A, the invasiveness of the actual interface being, I mean, we're talking about surgery, we're talking about an implant in and on your brain. So that's obviously something that scares people. But it's, it's absolutely fascinating. So there are companies building non-invasive brain-computer interfaces, and then there are companies like Neuralink that are producing invasive interfaces. And the idea, from what I understand you saying, is that the more invasive, even though it is invasive, it has a greater capability to gather more information and would have higher bandwidth and connectivity to the brain than a non-invasive version of that. Can you give us an idea? I mean, obviously we have, neuroscience is a very young, really, field, and we're still trying to understand what the brain is doing, and being able to. I mean, we have a lot of difficulty really understanding what consciousness or sentience is, much less how we turn electrical impulses in the brain into information, process that, and make it information that we can understand and use. So can you give us an idea as to what sort of technology Neuralink is actually using? Like, what are they implant? So a lot of you have seen this video of the monkey playing Pong, and maybe you can go into this a little bit, playing Pong with its brain. It's using its brain. The neurons are firing. It has an implant, and it's creating actual activity in a video game on a screen, just using its brain waves. Can you kind of give us an idea of how that works?
Yeah. So the brain is basically almost 100 billion neurons that control and do and perform everything that we see, think, hear, do, feel. It's all just these neurons firing like electrochemically. So there's like some chemical process and and mostly electrical process. The trigger is an electrical process. And so every time a neuron fires or has like a voltage spike, there's some information that gets transmitted. Yeah. And so if you can understand what those neurons are doing and why, or not why, but how and when they fire, then you can get a good sense of like what the brain is, or what the human is thinking or feeling or doing. So in this case, they implanted a Neuralink next to, or in both sides of the motor cortex of this monkey, and they're reading what neurons are firing during the time that the monkey is moving the paddle. So they're basically So they're basically like training to understand what he's doing. And then when they remove the paddle, they basically just send the signals that he would have done. Like it's like yeah.
Right, with his motor skills. Okay, so that makes a lot of sense to me. This is something that I didn't fully understand, I think, until kind of this moment. So basically what's happening here is the monkey is being trained to play this game, and it's firing certain signals in the brain when he's moving the paddle. And so when you take away the actual motor skills, or the computer is learning what neurons are firing when he's using those motor skills. So then when you take away the actual motor skill, the brain would still function in a similar way. So it's using machine learning to identify what the intention is. Is that the idea?
Yeah, this is very close. Like I didn't really explain it very well. But basically, like they're figuring out what neurons are firing when he's planning to move the joystick, and then mimicking the firing of those neurons, even though the joystick isn't there. So it's like if they're reading that if they're reading that he's planning to move the joystick, even though the joystick's disconnected, they'll just send that signal to the computer.
Right.
They'll just say like, oh, okay, we read that this neuron was about to fire, or it did fire, but he was like planning to move it. We're just gonna move it for him, basically.
Right.
So I misspoke earlier. They're not directly stimulating the neurons in his brain. They're stimulating, or they're triggering the computer to do what he would have done anyway if the joystick was there.
Right. And so just for those of you watching and those of you listening, you can't see this, but for those of you watching right now, well, it's not doing it anymore, but what he was doing was actually being trained. He was getting food in order to continue playing the game, but ultimately what was actually happening was the neurons that were firing in the brain were sending signals to the computer that the computer had learned were the signals that would cause that the monkey was choosing what to do with the Pong game, which is absolutely unreal. Okay, so obviously monkeys playing Pong is fun, but obviously we need real world application here. So what are you thinking when it comes to real world application? What do you see coming down the pike in the next, let's say 5 years?
In the next 5 years, I think it'll still be all medical applications. So at the beginning, it'll probably
I won't be able to get one for fun or for playing video games. Not so much.
Right. Yeah, I think that'll probably take 15 plus years.
Okay.
Yeah.
So you think we're a bit further down the road for that?
Right. Which I think is probably good. Like a lot of the medical applications are. It's like that's the thing that's most inspiring to me is the depth of positive impact that this could have for people who need it is unparalleled compared to like almost anything else, right?
Right.
Like
so
if somebody,
yeah, go ahead. Sorry.
like if somebody is blind and now they're not, or they have the hope of not being, that's a huge win. And the trajectory of their life completely changes when their blindness is solved. And not only their life, but also their immediate friends and family. So it's like that, you just like measure how much impact positively that is. It's like that's really game changing. So the first thing will be like helping blind people see. Another initial goal is to help paralyzed people use a computer keyboard and mouse, very similarly to what we saw with the monkey, except it would be a human, not necessarily playing a video game, but potentially like typing a Word document or typing emails in a way that they're not able to move their limbs right now. So that would be great. And then after that will probably be hearing loss, and we have some of these listed on the screen that was shown at the 2020 Neuralink presentation. And I think these are probably the indications that they'll strive to help solve. So like people with severe depression, people with strokes, anxiety, people who can't sleep, people with tinnitus or have seizures, or are addicted to something. Like many of these can be solved with I guess they think that all of these can be, because if you have a Neuralink in specific brain regions, you basically can just stop or know exactly when neurons are misfiring. And if you can control them, or you can stimulate them at the appropriate times, you basically have control over what the brain is doing.
Right. What do you think, and these are incredible use cases, when it comes to these sorts of things? So we talked about, we're talking about 10, 15, 20 years down the road for folks who want to use this maybe just to, and we could talk about some more use cases, real world use cases that aren't focused on healing brain function. What do you think is the timeline for some of these? I mean, obviously, we are moving more slowly, I think, than a lot of folks would like when it comes to these technologies, but they also need to be safe, right? We also need to ensure that we're using these things in ways that are going to be sustainable and going to be safe for not only the patient, but the company itself needs to protect itself as well. What do you think? From some of these technologies, how far out are we on working on, let's say, for example, blindness or paralysis? Like, how far out is Neuralink on some of these ideas?
They've demonstrated, well, so I think for blindness, it's one of the first indications that they're working on for getting approval for clinical trials. So, if they get approval and they can start clinical trials at the very end of this year or early next year, then I think they will have demonstrated the ability to do it successfully within a couple of years from now. And then after that, it will take some time to get more people who have the appropriate indication enrolled in the trial, or enrolled to be able to get this surgery performed.
Well, in the animal studies, are they testing these things? Are they looking at animals who are already suffering from things like deafness or blindness? Have they been able to create a proof of concept that these things are possible with BCIs at Neuralink, utilizing them on animals up to this point?
Yeah, in fact, in the latest demonstration in November, they were able to show stimulation in a pig, where like they could move a pig's limb because it had two Neuralinks implanted. So like basically this demonstration was proving that they're going to be able to help paralyzed people walk again. And that would require at least two Neuralinks, one in the brain and then one in the spinal cord area.
Okay.
Yeah. So basically, like when somebody is paralyzed, their brain is still often like able to send the appropriate signals to their limbs. However, their limbs never receive the signals that are being sent,
Right.
because of the broken spinal cord break. So if you can like reestablish that connection by identifying with the Neuralink what signals are being sent from the brain, and then you capture those signals, you wirelessly transmit them to around the break wirelessly to the other Neuralink in the spinal cord region, and then you stimulate that specific part that triggers movement in the limb, then you averted the break, and you
Right.
reestablish that connection.
Was this via Bluetooth? What are we talking here?
Yeah.
Right? Like what there's got to be, I mean, it's
Bluetooth.
wireless technology, yeah?
Right. And I think, so right now it's, I think it's low bandwidth. I think it's Bluetooth. Or low bandwidth isn't the correct word. I've heard low energy Bluetooth, I think.
Interesting. Brooks asks, what is the mechanism that it would help with anxiety and depression? Is this something that's already been, are they already working on this in animals? And is this something that they have some clarity around?
They have not shown that they're working on this in animals. I believe, well, so I'm not an expert in the brain, but there are like specific brain regions that deal more closely with folks who have anxiety or depression. And like the basic premise is that you would have a better understanding of what neurons are firing during the time that you feel most depressed, and then you just like you stimulate so that the person does not feel those things.
So you're kind of rewiring the neuron activity with the Neuralink?
Right. Yeah. So like they're going to have like very fine electrode probes near these various neurons, and you can receive what signal is being sent, and then you can send a signal to those neurons to stimulate them, as though like it were already being stimulated by itself.
Right.
So I guess there's some debate by some people that eventually like Neuralink would have to be supplemented with pharmaceuticals or some other like chemical drug. I think that could be true, but there are plenty of neurological conditions that they feel confident in being able to solve without any additional chemical intervention.
Right. Arlene asks, so this tech is kind of like an advanced version of the cochlear implants. Would that be accurate?
Yeah, I've heard that that's correct. I've not researched like specifically the cochlear implants in great detail, but I've heard they're very similar in architecture.
So what is the actual chip that goes in the brain? Like what's the device made of? What is it? What are the components here?
Okay, yeah, so there's a quarter-sized package. Inside there are, I think in the latest version, there are 4 chips. And then there's also like a charger. Oh yeah, so this picture is a brain proxy. So they created a fake brain, and in that fake brain, they opened up like a hole in the fake skull, and then they're demonstrating that they can use a robot to very precisely place these very fine electrode threads. And these threads are super, super, super thin. Like they're thinner than a human hair by a lot. And so you need a robot to be able to place these, because a human literally can't grasp something that's finer than a human hair with much precision at all. And then on top of that, you have to insert it, in a specific depth so that it stays there. And the brain is kind of like Jello. So you have this material science problem where you need to be able to insert it enough so that it sticks, but then also it has to be flexible enough because the human wants to walk around and move and swim and climb and do all sorts of stuff. And it needs to be able to stay there for, years or decades.
Right.
So anyway, this opening is exactly like what you would see in a human patient. And then the quarter-sized package that has the place to the battery for charging, the chips, and the connection to the electrode threads, you kind of replace that section of skull with that quarter-sized package and place it there. Yeah.
Wow. It definitely feels invasive. And the fact that it has to be implanted with a robot, I think, is truly incredible. I mean, this is the, taking this out of human hands and putting it completely in the hands of robots. Is that part of the reason why it's been difficult to get FDA approval for these implants, or are there other reasons that's slowing this down? I know that another company recently, I was reading about this today, BlackRock Neurotech, headquartered in Salt Lake City, has beaten Elon Musk Neuralink to human trials by implementing their BCIs in over 50 people, curing various ailments and disabilities. Neuralink, meanwhile, is still waiting on FDA approval to start testing on humans. Is this the reason why? I mean, are these other companies, do they have different types of implants that make it easier to get approval by the FDA because they don't need robotic equipment, or is there another roadblock here that I'm not aware
of? So I'm going to have to speculate because I'm not 100% sure, but based on me talking with folks at Neuralink and not about anything, talking to them about things that are all public, and then also learning more about the field, the sense that I get is that the robot is both helping and hurting them, because the robot is necessary in order to do this thing that's way more challenging than the rest of the industry has ever tried.
Right.
Prior devices had electrodes that were I forget, I think it's 100 times bigger. And they just kind of place them in the brain, and you don't exactly know where it's going. And it's very likely that you're going to pierce a blood vessel. Whereas the electrode threads that Neuralink is using, because there's a robot inserting these very precisely, they're able to avoid the vasculature. Because also the robot has a camera that shows you exactly where all the vasculature is. So it's basically a robot operator performing the surgery with the assistance of very high definition cameras seeing that specific brain area.
Right.
So it knows very precisely where to place them. If you can avoid the vasculature, the brain doesn't bleed. There's just the blood vessels don't get pierced.
Right.
And then on top of that, because it's so small, the brain doesn't even realize that it's there. If the brain did realize that this big thing was being inserted, it would go crazy. It would
right. It would try to push it out.
Exactly. Yeah, it would react pretty severely. So it's important that it's super small. like, so they kind of like reinforce each other. Like, because it's small, you need the robot to perform the surgery, but also you need the robot because you want to have a procedure that's scalable. Like, if they want to do this in millions of patients and people, then there's just not enough neurosurgeons to perform the surgery. So, so going back to your original question of, does this hurt them? I think it helps them show that it's safer, but then it also probably hurts them because it's new and novel, and
Right.
People haven't tried to do it on this level before. So the burden of proof is substantially higher.
Right.
The other company that was in the news was so BlackRock Neurotech, but then also there's another one called Synchron.
Synchron,
that
yeah.
they have like a device that you insert into the vasculature, and it's like a stent. But basically, like, you put the stent into the blood vessel network, and then it expands, and then you're able to get information from the brain with that. So it's invasive. It's less invasive than what Neuralink is doing, but they were able to get approval.
Right. So Synchron was able to get approval as well. And I believe, is this something that Musk is interested in acquiring? Is he looking to acquire Synchron through Neuralink?
I don't think so. There was articles that were rumors about that. I think it's unlikely because like their architectures are so different. And in fact, like in 2016, Elon had mentioned that there was an approach that was possible to be an interface for the brain that would it would require inserting the devices into the vasculature network, and then you could have access to much of the brain. So in 2016, when he had mentioned this, that's the same year that Neuralink was founded. That was probably what he was initially thinking was going to be the way that Neuralink was going to go. And then over time, I think in 2019 was when he first unveiled the newer architecture, where it was not going through the blood vessel network. So my guess is that sometime during 2016 to 2019, he realized this is not the approach we're wanting to take. Therefore, it would seem odd to me that fast forward 4 years, he would want to go back to that approach.
That's really helpful to understand. And I think that maybe, to your point, a lot of folks talk about the speed at which they're bringing Neuralink to FDA trials. It's not as fast as a lot of people would like, but it seems to me that that's because they're taking a completely different approach than a lot of these companies. So acquiring a company who's going in a completely different direction wouldn't make a lot of sense. As we begin to move into this new era of AI, and I know that was not the reason that you got interested in Neuralink. I know the reason you were originally interested in Neuralink was the potential for dramatic healing for folks who are suffering from blindness or people who are deaf. We are all now in this new world of massively accelerating AI. Do you think this poses any risks when it comes? I guess let me back up. So my first question would be: Will Neuralink and in what ways will this be connected to the cloud? I think that's one of the things that a lot of people are very afraid of, because if we were to have, I guess one of the major concerns about AI is the ability for the potential bad actors or potentially AI itself to have negative influence on human beings. And if that was able to connect directly to your brain, that might be a concern. Can you speak a little bit to that? And do you have those same concerns?
Yeah, I have some of those concerns. Previously, I didn't, because I was very much a technology and AI optimist, and I was kind of just like, I guess naively optimistic about this whole AI thing. I mean, I still think now the likely outcomes are majority positive. But there is some risk that we would have something that's substantially smarter than humanity as a whole, and that kind of is the first time that that's ever happened. So,
right.
But with regards to Neuralink, like I think, the initial reason that Elon embarked on starting Neuralink in the first place was he's always been concerned about AI development, and he's been warning folks from decades ago, saying, "Hey, we need to have some sort of regulatory agency overseeing the development of AI. We need to make sure that this is done in a safe way." He thinks that one of the ways that we can minimize the risk of bad AI outcomes is by merging humans with computers.
Right.
So that we can like go along for the ride. He always says that if you can't beat them, like if you can't beat AI, join them. And the way to do that is to basically have like a tertiary digital layer of the brain. So right now, the way he describes it is we kind of have two brain layers. We have the limbic system and we have the cortex. And the limbic system is the reactionary part of the brain that's like helping us
fight or flight. They call it the lizard brain. Yeah.
And then there's the cortex, which is like the thinking, planning portion of the brain that's kind of serving the limbic system. But we need both in order to survive and thrive in the world today. Well, we kind of already have a tertiary brain layer in the form of our cell phones. It just happens to be in our pockets. Well, with a Neuralink, you kind of move that phone to like be the third layer and like in the brain. It's the Neuralink, Apple Watch, Apple smartwatch, just immediately there. And if you can help them all interact with each other seamlessly, then they can serve all of each other in a good way. And so he thinks that that's kind of a way to go along for the AI ride.
So basically the idea is that as an insurance policy, having brain-computer interfaces could keep us safe in that we are merged with AI as opposed to being a secondary organism or a dumber organism that is not worthy of the AI's respect. It's really interesting because Elon was absolutely one of the first people who was talking about AI safety when everybody else was saying that's wackadoo. Like, I think there was a big problem in early AI with AI developers that they didn't feel confident to speak freely about the potential dangers and concerns of AI. They were treated as kind of kooky. And so I think it was back in 2015, 2014, Elon was talking to Obama about the risks of AI. And, at that time, I remember hearing about that. And I remember going, like, what AI? Like, where's this AI? Like, I don't see anything happening. And then all of a sudden, we get Chat GPT, and everybody's running around like with their pants on fire, going, oh my God, everything has changed. And it's like, this was always happening behind the scenes. It's just, it really came to public awareness, and now all of a sudden it's just out there. Is that your experience of this, or like what's your how are you handling? Because I'm like you. I mean, I've always been very optimistic when it comes to technology, to AI, but now I'm going, there are real threats. I mean, we kind of failed when it came to social media, right? Like, our world has never been more polarized, I would say, than it is right now. And that's definitely due to runaway algorithms in social media. Do you think that that's where we should be concerned with this, with AI?
I think it is a concern. It's maybe not my primary concern, but like definitely, like it's basically everything that we've experienced but amplified. And so, and I guess if the trends continue, which a lot of people presume they will, like the next thing is going to be video AI, and it's already happening, but like
Yeah.
Hollywood level films that are AI generated, and then you get like the deep fakes that are so phenomenally realistic that you just have no idea. I mean, even already there's like the AI spoof of Joe Rogan's podcast, and they
Oh
have
yeah, I
him
saw that.
saying,
Yeah.
yeah, it's like, I mean, there's endless examples of these things that look very real. And that's probably going to continue. So to me, like the primary issue is misinformation and misleading content, things that are, I mean, I guess one of the things that's the most tangible, and I could kind of feel it, was somebody was telling me how there was this scam organization uh, that had enough audio of a grandchild, and they were able to train like an AI model to replicate her voice, and then have her in a panicked, frightened voice call her grandmother asking for help. And the grandmother is 80 plus years old, doesn't know about all this stuff, and just thinks, yeah, I got to send money quickly, and it's terrible.
Yeah.
Because, if that's happening now, I mean, I think there's just plenty worse that could be done.
Yeah, yeah, it's getting really it's scary. Arlene asks, I don't really understand internet tech, so if my question is dumb, I apologize. No question is too dumb. Here, Arlene, are these links implants dependent on the internet? If so, what happens to the patients if the internet goes down? Can you speak to that a little bit?
Yeah, it would be as dependent on the internet as like our cell phones are today, pretty much. Yeah. Like so like our cell phones, we could place them on airplane mode, and then that kind of, that's like a software that because of software like prevents us from being very connected. A lot of people are saying, or Elon has said, that in the case of the Neuralink, you also want like a hardware physical off switch,
Right.
just in case.
Right. You need to be
So
able to shut it down. You need to be able to unplug from the internet. But it's not so for like the use cases like when we were watching the monkey playing Pong, right? It would be that was connected to a closed system, so it doesn't necessarily have to be connected to the internet, but you would want, I imagine a lot of use cases you would be connected to some sort of cloud server.
right, yeah, yeah. So I guess like just like with our phones, like you can have quite a bit of functionality even if you're offline.
Right.
Like yeah, you can take snapshots, and you can play some games, and you can do a decent amount. But the like having direct access to the internet is it just amplifies the functionality by many orders of magnitude.
Right. Right.
And I didn't mean to avert your earlier question on like the different use cases. Like I think the applications outside of the medical ones are primarily like gaming, defense, and adult entertainment, or at least those are the industries that tend to further technological advancements quickly. Like I think there are plenty of more specific applications for like basically quasi teleportation, um, and other like smaller things that are
What do
going to
you
be
mean by that?
fascinating.
What do you mean by quasi teleportation?
So like imagine in the longer term, you have like an advanced robot that has connection to like your Neuralink. You would basically be able to control that robot with your own thoughts. And if that robot has sensors and is able to climb Mount Everest, then you're basically there, and you feel and
Right.
see and hear everything that it's sensing.
Right. 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 That's Really interesting potential technology. And I think you said something really important here that I just want to make sure our listeners take a moment to digest. And that is the fact that technological developments are driven by capital investment. And those capital investments come from very specific industries. And you named three important ones. You named gaming, which is a huge industry, which, billion, trillion dollar industry. Defense, obviously, trillion-dollar industry, and adult entertainment. And those things tend to push technology forward. What are some, like, what do you think from a, like, because those things force pour money into the development of these technologies, do you have any ideas or thoughts or fun ideas on some what comes out of that? Like, what are the different niche markets that come out of that, or what are some interesting real world use cases? Because you've poured money in, now you have the ability to, you have just so many more abilities and technological innovation. Any thoughts or where you see some of this more fun or entertainment related stuff heading?
Sure. So with gaming, you can kind of imagine, like, instead of having to use your computer keyboard and mouse to perform tasks in the game, you just think like, oh, there's an enemy, boom, shoot, like immediate shot. And so that's kind of like the initial thing. And I think that's moderately cool. But then after that, there's this whole like immersive VR world where the game, you become so into the game that you don't even really recognize that you're in a game. It's just the simulation is fantastic and you're really in that world. So much so that you could almost come back to the real world afterwards and not really know like which one is more real. So then goes the theory that Elon always says, where, yeah, maybe our real world is a simulation, because
Right.
if you just continue the advancement of this virtual world, like you get to a point where video games become indistinguishable from the real world. So I think the first thing is with gaming, it would be like virtual reality gaming, where you're just in the world and you're seeing, feeling, hearing, and doing everything in that world. And that's a huge step for the gaming world.
Yeah, that's going to be wild. And you make a really interesting point here, because when I think about an interaction in, we talked about having the implant and being able to think and create, move the pawn guy or take a shot with a gun. In the real world, I think and I move my arm, right? It's just natural. It's just I'm immersed in my experiential data set that is my environment and my life and my body and my experience. And so when we have the ability to be doing that in VR, where I think and move my arm and I think and take an action, that the level of reality is would be indistinguishable from this reality. So yeah, man. Like, I wonder, it's like, to me, that's like the technological singularity, right? It's like the moment at which you no longer, like, being in your body is no longer the ultimate constraint.
Right. Yeah. Like I think I mean, I think you're right. It's like because it's not, it's like, it's really a gray area to know like when the singularity truly occurs, because, it's like the singularity kind of occurs in this specific place. And then, yeah, it's still kind of lagging over here. So it's like, but I
Right.
think in the case of like the video games, yeah, like it's there will even as somebody who doesn't really play a lot of video games, like I recognized that when I was like 10, video games were pretty good, and I was already kind of like shocked at how amazing the graphics were, and then as time went on and I was playing fewer and fewer video games, I still would go to people's houses and say like, wow, the like NBA 2K looks pretty amazing, you know, and then like somebody playing GTA 5 or whatever, and I'm like, yeah, that's crazy. And every time that I see somebody playing, it's like, oh my goodness, these graphics are insanity. So yeah, I mean, I think it's just only going to get closer and closer to base reality. And then so the next thing is with defense. I think because the stakes for war are increasing, it's more and more likely that wars are just going to be like bots and drone armies. Elon's mentioned this in the past too on one of his history podcasts. Like I've been thinking about this for, I don't know, long for a child's life. But I was thinking like, you know, it's like, it makes sense to me that planes or drones and non-human armies would fight with each other. Well, if you had that and you had them all equipped with Neuralinks, then like humans could be controlling what the bot is doing and seeing and feeling, or you could like one person could control an entire army. And I just think like with a Neuralink or with advanced Neuralinks, you could just have so many crazy things happen with defense and the whole industry.
Yeah, it's almost unfathomable because you take that potential, right? That potential of human beings who have Neuralinks who are attached to robotic devices, who are then in control of those robotic devices. Then you have artificial intelligence, which can create this exponential impact on that, and also be autonomous. So you have, it's almost as if you could have these humans who are interacting with these devices and AI simultaneously. Like it's almost unfathomable, like what the potentials are here. And you know, it's both captivating and horrifying.
Yeah, I mean, and that's a good segue to like the next industry of adult entertainment.
Porn.
Like, yeah, like you get to this place where like anything that you currently feel, it would just be like to the max, you know, and just like and like right now with like OnlyFans creators, so like somebody could have an AI version of a human that just rakes in money, you know, because you just have the most perfect features that you're wanting, doing anything that you want it to do.
Right.
And yeah, and but then in the longer term, it's like with a Neuralink, you just create any world that you want, and you just like, oh, you want more dopamine right now, like just
Boom.
crank that sucker out.
Yeah, it's almost like you don't even need haptics, right? So that's like that's the interesting
Right.
thing about Neuralink. You don't need like a bodysuit, you don't need a vibrator, it's
Right.
all in your head.
Yeah, like what you would have been feeling, like you just make yourself feel that.
Right.
Yeah. And so I guess that's where some people's concerns are. They think like, and potentially it's I don't know, there's some nuances here, but some people think like, okay, if the Neuralink gets hacked, then all of a sudden, like somebody else just, okay, you feel happy right now, no more, like boom, like ultra depressed.
Right.
And I mean, you know, if that happens, that's terrible. But I think there are fortunately some things that will help minimize the likelihood that occurs. So one is it's not super likely that people are going to be forced to get one of these, at least in a widespread way. Like maybe there are certain groups that it would be required for in the future, but I also think it's very difficult to like have forced implantation without consent and without the person knowing.
Right.
Like it's likely that the person would be aware that they're getting this surgery done. And then, and in the case of somebody who, you know, maybe they have a neurological condition where they are like crazy and they don't want this, but they don't realize that they should get this because it's going to prevent them from being crazy, then I think that's kind of a difficult situation. Like
Right.
you want to help them and they're potentially going to prevent you from helping them.
Right. It's a very similar quandary to like forced vaccination or something on that level, right? So it's like a forced medical procedure that, oh, we know best, and we're gonna force you to do that. But the other piece of that I think is important to recognize is like I I tell my son, it's like AI is not going to take your job, but a person using AI can take your job. And I think it's the same thing with like potential BCIs in the future. It's like you don't have to get one, but if you don't, your ability to compete in a meaningful way with other humans who have them is dramatically reduced. So I think we always, there's coercion, there's force, and then there's like social like adoption. And I think these things are all going to be kind of weaving their way through as this technology develops.
Yeah, fantastic point. Like I actually wrote that in the notes too. I was thinking like it's probably going to be similar to the adoption of cell phones, where like obviously this is a more invasive and more difficult to get device. However, at some point it does become like, yeah, everybody has one and they're better for it.
Right.
And yeah, this question.
Yeah. Sorry. Go ahead. Yeah. Go ahead.
No, yeah, this question about the expense being a hurdle, I think is probably correct at the beginning. Like, so Elon has always had this aspiration with Tesla to eventually drive down the price of the vehicles as much as possible so that there can be widespread adoption. But the reason they started off with a really expensive sports car was because in order to get to scaled volume manufacturing, they had to start off with something that was able to be sold at a high price point. Like even if they tried to go for the Toyota Camry inexpensive version of an electric vehicle back in 2008, they wouldn't have been able to do it. They just didn't have the scale. They didn't have the expertise. They didn't have the suppliers that were willing to negotiate for prices that were way cheaper. So it's like, no matter what, they were going to build an expensive car. They had to build something that could be sold at an expensive price point. So they started with the expensive sports car, and they'd moved from Model S and X down to, or Roadster down to Model S and X, down to Model 3 and Y, and eventually there's going to be a cheaper one, and they continue to try to push the prices lower. Well, in the case of the Neuralink, that's probably going to be very similar. Like at the beginning, it's primarily used for medical purposes. And then over time, it's going to be wider adoption and wider adoption. And hopefully there will be some competitors. I think it's questionable that that's going to be the case, but I think like competitors on a really real level. I mean, like I think there are some competitors that will try to compete, but they won't be competitive. And anyway, like I think once it becomes more and more widely adopted, there will be an initial question of, hey, I can't afford this, but the person next to me can. They have a huge advantage over me. That's unfortunate. But that was kind of the case at the beginning of when the iPhone came out too. Like, and those who adopted very early, they got a very good product, but it's nowhere near as good as it's not as good as the iPhone today, right? So if you just wait, like the technology will develop and become more mainstream. And I think people will get to a place where they're gonna come around to it, is my guess. As people will start to become more and more okay with getting the surgery done, because because also simultaneously, like the surgeries will become safer too. Like Neuralink's
Right.
going to continue to improve the safety of the surgery.
Right. You bring up such an important point when it comes to technological adoption, and the price point at which people, or the income level that people have to be in order to be early adopters in specific tech. But I mean, that goes back like century. Like if you think about who could get a pineapple in what 1700, like you'd have to be the richest dude on the planet to get a pineapple, right? In Europe or whatever. But now almost everybody in the developed world can get a pineapple. Maybe a little more expensive, but they can get one, right? And it's like the same things happen over time with technology, in that you have all of these super expensive early products, and then over time it just gets disseminated and disseminated and disseminated. And to your point about the iPhone, I didn't get in on the first round of iPhones. I was a broke dad. Like I had 3 kids. I was working, full-time job. Like I had to, I had the Nokia, I had the Motorola. All my friends were making fun of me. But like, that iPhone is nothing compared to the iPhone I have now. Do you know what I mean? And it's like,
Sure.
it will disseminate.
Sure. Yeah. And I think it's simultaneously amazing how much better the cell phones are today than they were before, and also how much they feel the same. It's like the progress of technology is like we just take it for granted so quickly after we get used to it.
I mean, ChatGPT. Like I've got on, and you're like, you get on ChatGPT and you're like, mind is blown, and then like a week later you're like, eh.
Yeah. You go like, it can't do this, and like,
yeah.
like I wanted it to spit out like 50 pages instead of 10.
Yeah, I can't drag in like a complete abstract from a scientific article and break it down into 3 bullet points. Like, come on, ChatGPT. Like, what's going on, OpenAI? Get your shit together. We're such babies. But you're right. Like we the second we see something new and cool, like it just the novelty wears off so quickly. I guess it's just our brain chemistry.
Yeah, maybe. Yeah, I don't. It's weird because it's like I think that's also what kind of causes us to like think of things progressing linearly. Is like there's always this, like, people in the AI community, especially, they'll say like, oh well, you got to try to predict things that are moving and improving exponentially, and you will people will think that uh, they're gonna underestimate how quickly things advance because they think that they're thinking linearly when things are actually increasing exponentially. But when we look like backwards, it still feels linear, despite that we knew that it was increasing exponentially. So
Right.
I don't know. It's just this weird phenomenon, but I think it's going to continue to be that way. Like we'll
Yeah.
just have these really advanced Neuralinks, and kids will grow up with Neuralinks being in mommy and daddy, or even implanted in them, and it's just going to be kind of the norm. And then all of a sudden it's going to be like, they just take it for granted. They think like I guess one other application that I was thinking of is right now when I want to speak to you or somebody in a different language, like
Right.
it's pretty great because I can do it quite easily, right? Like I speak in English, the phone gets what I'm saying, it translates it to Spanish, it outputs to whoever I'm speaking to, and then vice versa. They say something in Spanish, translate, comes back to me. In the case of like both of us having a Neuralink, I just think in English, it processes, sends to you directly, like to your Neuralink, and then vice versa. So it's like we communicate in different languages very seamlessly. And when that happens, like the kids are going to take it for granted.
Yeah. And then beyond that, this is where it all gets crazy, because like the only reason we think in words is because we learn language because that's how we communicate from one body to another body. But there will come a point if this technology gets so advanced and if everyone's adopting in it that we won't even need to think words to communicate ideas. Like that's the thing that is hard to wrap your head around.
Yeah, that's a fantastic point. Great point. It's gonna be wild to be able to like communicate in feelings, because words are lossy. Like we lose quite a bit of information, but if there's like a way to communicate precisely how I'm feeling, like it's mostly happy with a gradient to like a little bit of anger and whatever, and you're just able to say exactly that or communicate exactly that.
Imagine how many marriages will be saved.
Yeah, and how many will get killed because the real thoughts come out.
That's a good point. That's a good point. Some will be saved, some will get. It'll probably be the same ratio. We'll probably still have the same amount of divorces, just for different reasons.
Yeah, but I think the net effect is going to be positive because, like, if the more truth comes out, that's got to be better for the world. Yeah,
I think so. But I think the fear, that we all have is like, as an individual human, I have this thing called privacy, right? Like I have the ability to like have a thought, filter that shit. Like I could, and it's like there's something, I don't know, there's something so inherently human about having the ability to like have your own mental privacy. And it's going to be interesting when like I think that's where like I think a lot about this whole idea of transhumanism, this like moving from being a Homo sapien to like a different almost species through this sort of technology. And so it's like we're crossing this threshold of what it is like to be a human in the 2020s, and in the future we're going to be this sort of transhuman that's going to be a very different being because of this sort of technology. And it's scary, it's fascinating. I think they definitely covered this on Star Trek. I absolutely remember an episode of Star Trek where they have the species that like they're telepathic and they're all in this sort of hive mind, and I think that's really scary for people.
Yeah, the data security issue is going to be a real concern, and that's going to persist for as long as the tech exists, I think. And it's, there's always this open question too of like, who owns the data that, like, is Neuralink capturing all of the data specific to you? Are they capturing like the net result of all the data, or, and who owns it? And Elon's gone on the record many times where he says he believes individuals own their own data. And I guess this kind of goes to like a separate thing that I've been thinking of that I'm most excited about for the very long-term future of Neuralink, which is like right now, Tesla has all this data from many drivers on the road driving the Tesla vehicles. And every time that a driver performs a drive, Tesla's getting some amount of data about that drive. And if there was an intervention when the car was on autopilot, then Tesla knows, okay, this was a time that we should have done better. And then if there's like an odd corner case where there's a construction zone and two signals that were conflicting with a stop sign right next to it and a pedestrian crossing, like Tesla has that data that almost any other autonomous car company or regular car company, they don't have that data.
Right.
So Tesla has such an advantage having this fleet. Well, in the case of Neuralink, like imagine you have 1 million Neuralink implants or 10 million Neuralink implants, and you have 5 of them that have some sort of neurological issue come about. But you have the history of the prior 3 days of what their brain activity was. If you can have some sort of correlation to what this, illness is, then you all of a sudden can get good data on the next person who would have had that condition. And then also you start to develop this incredible artificial brain. Like Tesla's basically taking their fleet to train an artificial driver that they have access to, that they can now push out to all the vehicles, and it'll drive by itself. Well, Neuralink, it's like the same thing. They have a fleet, they get all the data, they build an artificial brain and pair with a Tesla bot, and then all of a sudden, like, you completely recreate a human that's smarter than a human and has more access to information than a human.
This is where we're headed, and I think that it's very difficult to like really imagine that. Like, I think I think here in 2023 it's really interesting to be able to speculate on these things, but like I don't think it's pure speculation. I mean, this is the direction we're going. It is fascinating to me because I read an article about what you're talking about, the autonomous data that Tesla is collecting with its entire fleet. And there's this really interesting article about how and this is changing, as you said, like as technology becomes more well adopted, it disseminates, and it moves throughout society, and people who couldn't afford before can't afford now. But there always is a point at which only the people with money and the people that are affluent are the first ones to have this. So, for example, in this Tesla example, there are people driving, for a very long time. The Teslas have been very expensive, and so the data that it has is data where people who are more affluent live, and not in a lot of these underserved or communities that are in poverty. And so the same thing could be said for what would happen with computer brain interfaces and this sort of thing. So it's really interesting or concerning, I should say, because you're going to have this brain this artificial intelligence that's being developed by affluence. And I wonder what impact that will have on the later adopters, or if it'll be a negative impact, or if everybody will just catch up. I do find that to be a really concerning scenario.
Yeah, that's a good point. I had not considered this factor, but I think there is some influence that will happen that way. Yeah.
Yeah, I'd never considered it. I was just like, oh, yeah, well, it makes perfect sense. But I have no idea what the outcomes are.
Right. Exactly. Yeah. Like, I think I'd like to think that over time it would kind of even out, because like in the case of Tesla with driving, I'm not convinced that it's like a gigantic difference, because like the rural areas where the poor people tend to be, it's like easier to drive those areas. In the case of the Neuralink,
well, when was the last time you've been on a dirt road?
Yeah. Well, I guess it's not necessarily easier, but it's less likely that you're gonna. I don't know. Yeah,
I don't either. I really don't.
Dirt roads.
Yeah, I don't know.
So I went to school in Indiana, man. Driving those like very rural areas in the middle of the night where it's pitch black and you are concerned about hitting a deer.
Yeah,
that's like, I felt more pressure to be on than like driving a very well lit, very heavily congested area near LA or San Diego.
Yeah, I know that feeling. I actually lived in Indiana as well. I lived right across the river from Louisville, Kentucky, southern Indiana. But yeah, like that, you're out there in rural Indiana, and it's like I almost think I would, as long as the again, as long as it has enough data to understand where I'm at and where I'm going and what I'm doing, I would almost trust the AI more. And this is the thing that, I think a lot of people are concerned about when it comes to self-driving cars and this sort of automation. This is, yes, absolute. Tesla cars have killed people. This is a fact. What is also a fact is that the American roads have been a bloodbath for a half a century. We've been dying on the roads like crazy for a very long time prior to autonomous vehicles. I absolutely believe 100% that as we improve the data sets and as we get more and more autonomous electric vehicles on the road, that is going to come down drastically. But it's a leap of faith that a lot of people just aren't prepared or ready for.
Right, right. Which, I think it's really difficult when people are not surrounded by what's possible. Like if they just don't have exposure to what's going on, then it's really difficult to conceptualize and feel how they would feel if they were using it, right? But like if uh, neighbor A and neighbor B both have a Tesla and I don't, then they drive it every day and they love it, then it's more likely that I'm gonna go along for a ride with them one time and see it and be like, oh, okay, maybe.
Right.
But if I've never seen a Tesla at all, never seen a self-driving car, and I only get news from online and it happened to be a bad video, then it's like, I'm never touching it and completely shutting it off.
You're terrorized forever. Right.
Yeah. And I think, I think that's probably going to be the case with Neuralink. Like, I think adoption will probably increase substantially when, or as more and more immediate family members and friends get one. Like,
Yep.
like if my uncle's best friend gets one, then it's like at least 10 times more likely that I would get one than if nobody remotely near me got one. I happen to
Absolutely.
be somebody that I would probably be okay with it much earlier than most people. But I think for a lot of folks, if like hearing chip implanted surgically in brain, like it makes sense that they would be skeptical,
Right.
as they should at the beginning, especially.
Right. And but this is such a human phenomenon. Like this is not new at all. Like for, you think about like when did gay marriage with the first gay marriage bill, I think I can't remember, maybe 2010, 2011, something like that. The majority of the American people were not for gay marriage. It wasn't until people started coming out and that you had an uncle or a brother or a sister, the visibility of people made it, oh, okay, this is not something I need to be afraid of. This is people, this is a normal person, it's not no big deal. This is such a normal human phenomenon that until we are connected and close to it, do we begin to go, oh, okay, this is not something I should fear, because fear is we talked about the limbic system earlier in the brain. The limbic system is that thing that makes you go, fight or flight or freeze. And so anything that you don't know, you fear, and it's going to make you do that. But the more you know about it, the less you're afraid of it, and the more you can accept it, and the more, So I think it's interesting that we're going to see, to your point with the Teslas, the more people have a connection to a person and you write it and now you're like, okay, this isn't as scary as I thought it was.
Right. Yeah. I think that's the perfect example. It's like, man, and now fast forward, like it's been 13 years or so, but it's like, it's just crazy that, I mean, there's like a lot of stuff that I think it's crazy that people still feel the way they feel about certain things. And
Yeah.
like, that was one of them. It was like, hey, the mistake that people are making today about gay marriage is the mistake that you guys made about like women's rights back in the day and
Right.
Black people's rights back in the day. It's like, hey, just like put yourself in the form of thinking in hindsight, like how crazy this is going to be. It's like crystal clear and super obvious that people should have equal rights.
Right. And then just wait till we have the conversations in the coming years about the AI equal rights.
Like equal rights for like completely digital models.
Yeah, like yeah, exactly.
Yeah.
I mean, we're inventing a species. We're inventing a new intelligence.
Right. Yeah, and it's been interesting to hear the idea gain traction of like just an AI model being a like a senator or being a like a political figure or leader or even like a CFO of a company.
Right.
And I, like I'm still uncertain with how that's all going to shape up, but I think there's also a question to be had about uh, like what earlier you brought up concerns about how AI is going to shape our world, but then also it's like how are humans going to use it, right? Because if you have a human that's using AI for good for their job, then that's more dangerous necessarily than just an AI itself trying to replace a human. And I think the same is true for like the bad side. Like if you have an AI model that's trying to trick people into thinking a certain thing or selling a certain product, like that's quite bad. But what's worse is a really smart person using a fantastic AI model. And yeah, we got to figure out how to deal with those bad actors too.
Yeah, yeah. I mean, this is a new power that humanity hasn't seen before, similar to, nuclear technology in certain ways. It's that, is it the AI coming to life and creating sentience that we should be worried about, or is it just having this incredibly intelligent, incredible intelligence being wielded by bad actors? And I think that's where, and it's cool, like people are starting to wake up to this threat. I mean, the White House, I think, called for an AI risk assessment today. They're bringing Altman and a bunch of these other guys in to start having these conversations. And if it wasn't for ChatGPT getting released, maybe we wouldn't be having these conversations. So I really respect OpenAI and Sam Altman for going, you know what, we don't want to just develop this technology in a black box. And so all of a sudden one day we're going to drop AGI on your fucking heads and then like all chaos, right? Like it's just going to be, absolutely horrifying. They're like, no, we're going to release this to the public in small stages so that we can, as we're building up, people can be thinking about this. We can be talking to, our policymakers so that we can actually be moving good policy and safe AI forward. So I think that's a good thing, and I got to respect those guys. Listen, Ryan, it's been an absolute pleasure spending time. I could literally talk about this for like 7 hours straight, but I do got to get out of here. But what a pleasure being with you today. I'd love for you to share with folks how they can find you, how they can find Neuropod. You're doing such amazing work, and I just want to make sure folks out there know exactly how to find it. Oh, I think you got muted somehow. Oh, there
Awesome.
We go.
Yeah, my bad. Yeah, awesome. Thank you. On Twitter, I'm at Ryan Tanaka 3. And then I guess there's also a Neuropod Twitter that's just at Neuropod, Neurapod. And then on YouTube, same name. And I just try to cover like updates and news about what Neuralink is doing. But yeah, likewise, it was fantastic to speak with you. Last time we did it, I knew you were a fantastic host. So and asked great questions, great energy. So thank you again for inviting me to do it.
Absolutely, Ryan. No, thank you. I really appreciate your time today. And it was an absolute pleasure. And I would absolutely love to do this again with you sometime. Yeah, make sure you go follow Ryan. Go check out his show on YouTube, Neuropod. Ryan, absolute pleasure. And thank you, everybody, for joining us live here today. Make sure you click that like button below. Make sure you subscribe. If you didn't know, we are on Apple Podcasts and Spotify, so you can check us out there as well. Until next time, we'll see y'all soon. Bye-bye.